Now, to learn more on that, with us on telephone line is Dr. Abdallah bin Salem Al-Qayudhi, Head of Infection Control and Prevention in Healthcare Facilities around the Sultanate, and he is also a consultant from the Directorate of Disease Surveillance and Control at the Ministry of Health. Dr. Abdallah, thank you for joining us on Oman Television.
Thanks, Mr. Abdallah, and thanks to give me the chance to talk briefly and brief you about an important and threatening topic, which is the antimicrobial resistance.
Indeed. So what can you tell us in general about the microbial resistance and why it is seen increasing in the world?
The antimicrobial resistance, the meaning of it, when you have microbes like bacteria, viruses, or fungi, which resist the effect of medication. So you can imagine if you have this type of bugs, which will be hard to treat it. So directly that will affect the care of the patient in the hospital. And definitely that will lead to severe infection and death of these patients inside the hospital.
Mm-hmm. And why this week is so important, and what action Oman took to control the spread of microbial resistance?
Oman actually one of the country in the Middle East which pay a great attention to the antimicrobial resistance in general, and we have a national strategy plan in place, and also Oman launched the Oman Antimicrobial Resistance Surveillance System, which we call it OMAS, in 2016 to monitor the antimicrobial resistance in Oman. And also we have a program to educate the healthcare worker, increase the awareness of the public, and also we have an action in place to control the consumption of antibiotic, and just we allow the doctor to prescribe certain medication.
Now, as you know now, because of COVID-19, how COVID-19 then contribute to microbial resistance?
This year we have the COVID-19 pandemic, and actually this led to misuse and increased consumption of antibiotics during this pandemic. As we know that COVID is caused by virus and it's not by bacteria, and there is no antimicrobial to treat the virus itself. So that led actually to increase prescription and misuse of antibiotics, which led actually to increase the antimicrobial resistance.
Now, Dr. Abdallah, one would wonder why this microbial resistance. We have doctors who prescribe the antibiotics. We also have patients who use the antibiotics. Can you tell us about both areas? From the doctor's side, what is a problem there, and how you want to tackle this? And what is the problem with the patient side, and how do you tackle this as well?
That's right. So from the doctor side, some of the doctor, unfortunately, even for viruses, for like common cold, if the patient presents to the healthcare facility with a common cold, he prescribed the antibiotic. And this is actually not right. That will not lead to improve the condition of the patient, and that's not going to treat that virus or the common cold. This, in turn, will lead to increase, as we're increasing the pressure in the microbes, that definitely will lead to increase the resistance to this certain antibiotic. So when we move to another antibiotic and we start misusing this antibiotic again, this bacteria, it's so clever, so will develop resistance again to this antibiotic. From the patient side, unfortunately, some of the patients, they will not be happy. Unless he got like antibiotics or any antimicrobial, antiviral, whatever from the doctor. Even if he has like an infection caused by a virus, which there is no treatment for it, so he will not be satisfied unless the doctor prescribes an antimicrobial for him, and that's wrong actually. So this should come from the public They should like have this awareness. This is really will be more harmful than really useful for the patient himself if we just continue the same practice, taking antibiotics from here and shopping from one patient, from one doctor to another doctor, from one healthcare facility to another healthcare facility to get that antibiotics. That really will lead to increase this problem.
Indeed. So this is again a message to the public, patients in particular. When they get the antibiotics, they need to stick to that one, not to go and keep changing. And again, the message to our dear doctors to stick to the protocols. That was, of course, Dr. Abdallah bin Salem Al-Qayudhi from the Directorate of Disease Surveillance and Control in the Ministry of Health. Once again, Dr. Abdallah, thank you very